Eight early signs that prostate cancer is growing in your body. This is the topic of our discussion on this video. I'm going to make it very short, straight to the point, but it's very striking. Men, please, if you are close to 40 years, let me not talk about people who are above 40, 50 and more. Therefore, there is a certain age you need to watch out for signs of prostate enlargement, for signs of prostate cancer. This video targets that. My name is Dr. David Ayim. I am in Bamenda, Cameroon, your midwife, your reproductive health expert. Of course, I hold a PhD in public health, and I have chosen to work with you as far as reproductive health is concerned, as far as sexual and reproductive health is concerned. Some areas people seem to be neglecting, but in my specialty, there are those issues we need to take serious so we can live healthily, so we can have chances to live longer and stay away from certain complications that relate to reproductive health. Now, the prostate gland, remember, is a secretory gland along the male internal genitalia or genital organs. From the outside, you find a hole entering at the tip of the penis. That hole goes deep inside, they call it the urethra. As it is going inside, you meet first a secretory gland called the corpus gland. And just after that, you have the prostate gland. And they have their great functions, in facilitating, the health, the processes, the activities that take place in the male reproductive system. This particular gland, the prostate, is also vulnerable, is also prone to certain disease condition. When its size starts increasing, when it starts enlarging, it could easily complicate into cancer of the prostate. Studies have actually proven that prostate cancer is one of the most common cancers in the body of a man. As the man is growing old, especially from the ages of 40 years and above. Studies have even proven a lot of men, as they are growing old, they get affected by prostate cancer and die of prostate cancer. They talk about a great number of men that die all over the world every year in their numbers of prostate cancer. Yet, my dear brothers, there are early signs that we need to take note of. If you have been having any of such signs, you need to rush to the hospital. You need to meet your doctor. You need to consult in the hospital. When prostate enlargement or prostate cancer is diagnosed early, what we have read from various books tell us that early diagnosis leads to high survival rate. The rate of survival, what we also call prognosis, possible outcome, success rate is up to 98%. What are we saying? If you notice certain signs and quickly go to hospital, and in case your prostate was developing a problem, it will be diagnosed early. When they diagnose it early, they can easily treat it. Research has told us that 98% of those diagnosed early are treated. So the people are fine and live their life. But when they diagnose it when it's already late, the survival rate is very low. You go. Who would like to go so soon? Do we just come and die even of things that we need to know how to control it and prevent it and live longer and healthier? Now, every man, regardless of age, needs to know these signs. I'll give you like 8 signs to watch out. Number 1, frequent urination, especially disturbing at night, nocturia. Yeah. In our profession, in our medical jargon, nocturia means, urinating in the night urination. You cannot even sleep. Very soon you wake up to go out and pee. A lot of people attach that sign only to diabetes. Of course, it is true when you are suffering from diabetes. But then, watch out. When you are having frequent urination, please go check yourself. The prostate might be having a problem. Number 2, painful ejaculation. During intercourse, there is a climax that a man ejaculates, that some secretions come out from the man. If during that moment of the climax or of what we call orgasm, ejaculate is being pulled out, you feel pain, ? Go check yourself, my dear brother. Go check yourself. Number 3, blood in urine or blood in semen. Semen is that ejaculate, the secretion that a man will ejaculate during sexual intercourse. That's semen that usually has sperms. If that semen comes up and blood is mixed in it, it's not a good sign. Hurry. If you urinate, since a man urinates through that same passage, the urethra, and also ejaculates through that same passage, when your urine comes out and there's blood inside, go for checkup, my dear brother. Number 4, pains during sitting, or pains that you feel in a sitting position. Like I'm sitting. If I sit like this and feel uncomfortable from under there and feel pain, it might just be coming from an enlarged prostate gland. So there are times some people, just by sitting, they feel some discomfort in a sitting position. Then go for checkup, my dear brother. Number 5, pain in the back, pain in the hips, and even pain that radiates to the chest, the ribs. There are times when you find a man keep complaining of back pain, and then on the hips, right, the buttocks there, he will tell you that they feel pain there. And sometimes, if something is not done fast, it starts radiating, and one time it starts feeling even on the chest wall, the ribs. Studies tell us that it is a sign of prostate enlargement. It could be prostate cancer. Go for checkup, my dear brother. Number 6, swelling in the legs and feet. You just find somebody at a certain age, the legs, the feet on the ground like this are swelling. They might not be paining, but that tells you that something is not going well. We also learned that prostate enlargement alone compresses on blood vessels that supply the lower extremities, and venous return is not very good. And so there's usually accumulation of fluid. You start finding your legs swell on the ground, please Some will always just say, no, because I traveled. No, I left from this town to this town. Like in my country, Cameroon, somebody will say, I left from Yaoundé to Bamenda. No, I traveled in a car from Douala to this. That's why I came and my legs are swelling. Question mark. Go and check up. Go and check up, my dear brother. I'm alerting you. Very, very important for you to go. Number 7, weight loss. Especially unintentional, unexplained. Sometimes even you get worried why you are growing pale, why you are losing weight. They will tell you that prostate enlargement or prostate cancer in most cases is responsible, especially when the man is above 40, 50, 60, 70. Please, it's good to go check. Go for such checkup. Number 8, numbness. Numbness and weakness. Okay. I don't know. In most cases, numbness in the legs and weakness. Somebody will get up and complain that my legs are like numb, like dying. Somebody will carry the leg up and hit it, pop, 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 pop. Will pinch down up to from the hip, even down the thighs, down, and tell you that the legs are numbing, like dying inside. Yes. Prostate enlargement, prostate cancer in most cases affects nerves that supply the sensitivity of the nerve supply to your legs. That may just be the result. Go see your doctor. Yes. And that was number 8. I told you, giving you 8 signs. Don't forget that any form of compression, especially on the spinal cord, can cause numbness in the lower extremities. A prostate enlargement can do it. Ladies and gentlemen, remember, even when we are talking about men, ladies should listen and be more attentive, because a lot of you can help us men to sit up and even live longer lives. There are certain risk factors that put somebody at risk of developing prostate cancer. They range from 1, age. As somebody is growing older, it gets vulnerable. 2, family history. Some people come from family where, prostate cancers are common. It looks like it's something running in blood. Then if you come from such family, the earlier you start watching out, better. Then you have obesity. Those people who are fat, they have weight, excessive weight gain, very fat people. That should tell you that you are already at great risk of prostate cancer or prostate problem. And lifestyle. Some people live lifestyle that is not good. Some smoke a lot. Some drink a lot of alcohol. Some take even unauthorized drugs. Some are already addicted in fighter, or they call it what? Some sachet whiskeys are around my community now, around my country now. I don't know what magic they will use to delete them from the community, from the market. Sachet whiskeys, and you will be so surprised to hear that even little boys and girls and girls of about 12 years, 14 years, 16 years are involved in buying whiskey in sachets. You'll hear somewhere where some of those state names, it's not even good for us to be calling on, we're giving cheap adverts. But you know them. Different names. Sachets. A lot of young people, not the top of the old ones, are just addicted. Because you will not imagine that somebody wakes up very early in the morning, he has not even eaten, he rushes to do one. Buy some sachets. After all, they're cheap. 100 francs, 50 francs. Yes. And some have been taking on to, it is not good for themselves, for their body again. A lot of people are going wayward, and the health is also being affected. Watch your lifestyle. It may be too rough. that may predispose you to other troubles. If you like our video, subscribe, like, and share. Please, the contact that you can talk with me one-on-one, 694-35-3141. If you are not in Cameroon, always start with +237. Write a message or a voicemail. Don't call, please. We will always attend to you. But make your comments. They will always help us on the comment section. All right. Good night. Good day, wherever you find yourself. Bye-bye.